welcome to the final segment of a four-part series about how codependency is better understood from an attachment theory framework. Today we're going to talk about that and also talk about attachment from a meaning-centered perspective. So when we consider the defining elements of codependency, diffuse boundaries, excessive reliance on another, and underdeveloped sense of identity, we see how attachment theory can explain that through an avoidant or anxious attachment style. In fact, many current proponents of codependency do explain the codependency through attachment style, both anxious and avoidant attachment styles, and they use words like pursuers and distancers. So if we look again at the figure from last week, we can see that somebody that's high in anxiety and low in avoidance would be in the anxious, preoccupied attachment style. Now that would be a pursuer, whereas somebody in the low anxiety and high avoidance side, that would be somebody that they would classify as a distancer. Attachment theory explains rather than blames for these roles. From an attachment framework, we can see the pursuer is actually anxious and just looking for assurance from their attachment figure, whereas the distancer feels anxiety when somebody is getting close, and so they're trying to get space. So these two styles can really play off of one another. The pursuer looking for assurance, the distancer looking for space, and both due to anxiety. So if either can give a little bit in, either the pursuer giving a bit of space or the distancer giving a little bit of assurance, then that can create security in the relationship. This is all very understandable from an attachment framework. So the good news here is that the more secure you feel in yourself, the more secure you're going to be in relationships. So attachment is important from a meaning-centered approach because, as Dr. Paul Wong emphasizes, meaning-centered therapy focuses on relationship and meaning. So attachment theory states that one's early patterns of attachment do not determine shape, but do not determine one's expectations in later relationships. So for example, imagine if I were raised, my first caregiver was very reliable. They were always there when I needed them, and I could trust them. So that was my first example of a person. So then later on, of course, I would come across examples of people that weren't trustworthy, and I would adjust myself accordingly. But that original idea of what a person is as being trustworthy would stick with me. However, imagine if my first caregiver was not reliable, and I didn't get a sense that they cared about me too much. I learned that people aren't really very trustworthy, and this was really imprinted me for the rest of my life and my relationships. You know, I'd meet other people and some of them would prove me right that people aren't trustworthy. But hopefully I would meet enough trustworthy people and I would come to understand that both are true, that there are trustworthy people out there. So further work in the attachment theory field has found that the way that we understand ourselves and the way that we feel about ourselves has a direct effect on our attachment style. So if we feel insecure, we tend to have insecure relationships. So one of the main questions that we ask the guys here to work on while they're here at SCHC is the basic human question of, who am I? And by asking them that question and them working it out and figuring out more who they are as people, it helps them not only with their relationship to themselves, but also with their relationship to their loved ones. So I hope you have found this information helpful and that you agree with me that the concept of codependency is better understood through attachment theory. And I look forward to bringing you another series next month here at the Sunshine Coast Health Center.